welcome everybody to our webinar about the new product lines that we are launching, or they're in the process of launching right now. They will be presented by Dr. Anastasia Lapsyna, our key opinion leader and the medical director of the Ukrainian company, of our Ukrainian distributor patologies. They're actually, well, Anastasia is actually working with our products, I don't know, for more than 10 years. So you can ask her as many questions as you need. Please do it through chat, as it will be more comfortable for everybody. Just to let you know that we're going to record this webinar. We are actually recording it. So in the next few days, you will receive the link that you will be able to share with the rest of your team that was not able to assist today. Thank you very much for connecting today, and thank you, Anastasia, for being with us. I leave you with the audience.
Thank you, Kati. Good morning, everyone. Thank you for joining us today. Today is really very interesting topic because Innoaesthetics is going to launch several new lines which will help us to cover with different kind of dermatological pathologies of our patients. And today we are going to know about some peculiarities of how it's possible to use these products, what are the main protocols of treatment, who are the patients, and how to obtain the better results. Also, it is very important to understand what are the ingredients which give us the result. So everything we will discuss today in order to understand how to use it, how to recommend, and what to recommend our patients to use at home in order to optimize the results which we can get in clinic. And I am sure that it will help a lot with the different kind of treatments with your patients. So first of all, we are going to talk about sensitive skin and what we can do about such kind of peculiarity of the skin of the patients. And we have to understand that sensitive skin is usually referred to as reactive skin, hyperreactive skin, or skin prone to irritation, for example. So this is the skin which is usually manifests erythema or some specific sensations like burning sensations, tingling, itching sensations as the answer to some environmental triggers, as the answer to some chemical or physical triggers, which usually for the normal skin are not the factors which can cause such kind of reaction. So the triggers, as I've already mentioned, can be physical, for example, UV radiation, heat, cold, wind. So mostly these are climate factors, let's say. Also chemical factors, which we can say that this is maybe the main strong triggers. Chemical factors can be different kind of cosmetics, makeup, soaps, pollution, and so on. Psychological triggers such as stress is also very important. So we can say that sometimes there are patients who never had the problem of sensitive skin, but after experience of some kind of stress, they are noticing that their skin reacts in a completely different way to those factors that before were not triggers for them. And hormonal factors, especially menstruation cycle for women. So that is why usually women are more prone to sensitive skin than men. And I'm sure that you already and also noticed that skin of women is really reacting in different way towards home care, towards professional treatment. You know that the same patients can come to your clinic in different periods of the menstruation cycle, and you see completely different reaction even towards professional treatment like peelings, mesotherapy. Sometimes the redness of the skin is more evident. Sometimes the papules after mesotherapy are stained for longer periods. Sometimes the skin is completely calm, for example. And also the feelings of the patients can be different. So sometimes the same treatment can be more painful, sometimes it's less painful, and everything depends on the hormonal factors. So actually, this is really very important. That is why during the consultation, it's very important to ask the patient, do they feel any differences during the different periods of menstruation cycle? General consideration about sensitive skin in order to understand the nature of the hyperreactivity of the skin. So the first is etiological factors that I've already mentioned, and one of them is the environmental factor, which is actually almost impossible to influence, because if the patient is living in the country or in the city where there is a lot of sun, or vice versa, this is the cold country with a lot of winds, with a lot of frost, unfortunately, we cannot eliminate these climate factors. So we have deal with them somehow, and we have to recommend to our patient to use some specific products which will help them to calm the skin and somehow to live in this environment and not to have problems with the sensitivity of skin. Mostly the main factors of the hypersensitivity are external stressors. So that is why, again, we need to do something in order to make the skin not so reactive towards these factors. Also, it is believed that one of the main etiological factors of the hyperreactivity and sensitivity of skin is greater permeability of the skin because of different damages of the stratum corneum, and that is why we have to work with the acceleration of the skin response to all these environmental factors. Talking about epidemiology, we can say that it is considered that women are mostly prone to sensitive skin and more than men. But there are some clinical trials now which are showing that there is actually no difference between the sensitivity of skin of men and women. Before, really, it was some kind of difference between men's skin and women's skin, and it is considered that the main difference of the sensitivity was because of the cosmetics. So now, in this period, men and women are using some kind of home care, some kind of cosmetics, almost equally. And maybe that is why the sensitivity of skin of men is really a little bit higher than it was before. But before, when women were using more cosmetics than men, it was noticed that the sensitivity of skin of women was really higher than men's. And also, of course, hormonal factors are very important. We've already mentioned that the period, the menstruation cycle is have to be evaluated during the treatment and during the diagnosing of the sensitivity of skin. Talking about epidemiology of the sensitive skin, it was noticed that fair phototypes like the first or the second phototype are usually more sensitive than third or fourth phototype or more dark phototypes. It is usually considered that for example, Asian skin is can be more sensitive than Caucasian skin, and so on. About the age, it is really interesting to know that the more aged the patient, the less sensitive skin. So aged patients are really less reactive, and maybe there is an idea that it can be considered with less reaction of the nervous fibers of such kind of patients. And there are different studies that can show that the patients between 56 and 74 are really significantly less reactive than young patients. So mostly the higher sensitivity of the skin is observed in the age from 25 to around 45 years. There are different types of the sensitivity of skin, and we understand that thinner stratum corneum can lead to the sensitivity of skin. So we have been already discovered that if the stratum corneum or if the epidermal barrier is not functioning in the correct way, and the main function of the skin barrier is to protect the skin from different kind of damages, from different kind of microorganisms, from different kind of pollutants. But if the epidermal barrier is damaged, then it means that the skin is not protected from all these damages from the outside. And in this way, we can see hyperreactive skin. Also, it is very important that usually so the skin of the patient can be either oily or dry, but of course the reduction in the number of the neutral lipids can lead to the sensitivity of skin. So the skin can be oily, but the balance of the oils of the skin is altered. So it also influences the reactivity of the skin. In such a way, this condition of the skin facilitates to the penetration of the irritants and to the reactivity of the skin. Sensitive skin is usually prone to the transepidermal water loss. So of course, we understand that if the epidermal barrier of the skin is altered, then the stratum corneum and this barrier cannot hold the water inside the skin. That is why sensitive skin is also associated with the dehydrated skin, which increases the reaction of the skin, because in dehydrated skin, the processes are not going in the way they should go. We see that the proteolytic enzymes are not working in the way they should work. So really the skin can be dry, flaky skin, rough skin, and so on. And usually sensitivity of the skin is not related to dysbiosis or some kind of alterations of the microbiota of the skin. It is considered that the role of the skin nervous system is really very high in the sensitive skin. So the variety of sensorial symptoms indicates that neurosensorial disruptions can be one of the pathological mechanisms, because usually during the high sensitivity of skin, your patients have not only objective symptoms like redness, like some kind of inflammation of the skin as the answer to the irritants, but also your patients will tell you that they have some kinds of feelings like burning sensations, tingling sensations, the sense of warmth of the skin, and so on. And this tells us that really the sensitivity of skin can be associated with the disruptions in the neuroessential pathways. It can be associated with the fact that the nerves endings are not protected. So if the stratum corneum is very thin in this condition, of course, unmyelinated fibers can be triggered by any kind of stressors from the outside. And it leads to the hyperreactivity of skin nerves, and it leads to some senses about which your patients will tell to you. Also, it is very important to understand that such kind of or any kind of sensitivity of skin is associated with the hyperreactions of TRPV receptors, which are expressed in such cells like keratinocytes, mastocytes, and Langerhans cells. And as soon as these receptors are activated, it leads to a specific inflammatory reaction. So here we can see the pictures which can show us what is happening during the some stimuli, some irritants will influence our non-myelinated nerves fibers. So as soon as it happens, the P substance will be releasing, calcitonin-related peptide will releasing, and also vasoactive intestinal peptides. And after, it will lead to the degranulation of the mastocyte, and histamine will be relieved, which of course will lead to the non-specific inflammation. And because of the non-specific inflammation, then there will be a high level of interleukins, of tumor necrosis factor. So it usually leads to the redness of the skin, to the swelling of the skin, to the signs of inflammation. Calcinogene-related peptides and vasoactive peptides are also leading to the non-specific inflammation. That is why we again can see all the symptoms of the sensitivity of skin. What do we usually see on the skin of the patient who is coming to you for a consultation, and how we can evaluate the situation which is happening in the skin? So all the sites can be divided into subjective and objective symptoms. Objective symptoms are those that you can see and you can evaluate. So you can see redness or erythema, you can see less elasticity of skin, you can see that the skin is less hydrated, and you can suppose that this is associated with transepidermal water loss, for example. But there are also subjective symptoms which you cannot evaluate, which you cannot see, and sometimes you have to rely only to the words of your patient. So they are coming to you, and you can see that the skin is fine, it's not red, there are no any kind of irritation on the skin, but the patient will tell you that as soon as they are using something, as soon as they are using some cosmetics, or sometimes when they are contacting with the water, or when they are going outside and there is wind, there is cold weather, or there is sun, for example, they can feel itching, they can feel burning, they can see pruritus, for example. So these are the subjective symptoms which you have to try to evaluate. And in order to do that, we usually can use some products. We can use cleansers, we can cleanse the skin of the patient, and we can see what is happening with the skin. If there are any changes, will the patient tell to you that they feel some burning or something? So this is very important to try to use something, to use some triggers like some acids, for example. Sometimes salicylic acid can be used, especially in the areas of nasolabial folds, and you can see the reaction of the skin. Or, for example, if the patient is telling you that it's always something itching, something burning, they feel something inside the skin, but obviously you cannot see nothing, maybe this is the consequence of some kind of stress, and in such a way you have to recommend to your patient, of course, some home treatment, but maybe it is important also to recommend the consultation of psychologists, for example, or it is very important to work with the mental condition of the patient in order to calm down a little bit the patient, because also these kind of subjective forms can be associated with the different kind of stresses. As for the affected area, so usually this is the face, and talking about the face, the most sensitive area on the face would be middle face, the area of the nasolabial folds, and actually this is why these are the areas where usually we are trying to use the triggers while the consultation of the patient. So I've already mentioned that we can use salicylic acid in the area of nasolabial fold, and this is because of the really higher sensitivity of such kind of areas. So in order to put the diagnosis of the sensitive skin, it is very important to evaluate both subjective and objective symptoms of the patient. There can be several tests that we can do in our clinic. These are like cleansing of the face and watching the reaction of the skin. This can be using of some kind of superficial peelings or acids, topically, not for the whole face, just to see the reaction of the skin. But unfortunately, there is no international consensus on which of these is the best method and which is really the correct method. So as soon as we understand that the patient really has sensitive skin, then we have to recommend something and we have to understand what we can do in the clinic. So what professional treatments we can recommend to our patients. And of course, this is really not easy because as soon as you're going to use something, as soon as your patient will start to use like the new product at home, usually during the first day of using that, sometimes weeks of using that, they will tell you, you know, doctor, no, this is not a good product because I feel something, I feel burning, I feel itching, it's not better, it's like it was before. So what I'm going to do and what do we have to recommend to our patient. So the first and the main strategy is like to keep the skin on a diet. So in this case, we ask our patient not to use the product which were used before. Maybe it was soaps, maybe these were some kind of creams, even makeup. So we are trying to eliminate all kind of stressors, all kind of chemical substances that, of course, can be the triggers. Also, we are trying to avoid the use of topical steroids in all the circumstances because, yes, they can give us very good results at the beginning of the treatment, but as soon as we will stop using them, the skin will be sensitive and actually it doesn't make any sense to use it. To recommend to patient to use as most soft products as possible with them with not a lot of active ingredients inside. If we are talking about the professional treatments, then of course the interval between the sessions should be longer than usual. So if you are going to use superficial peeling, which you are usually doing intervals like 1 week for the patient with the normal skin. In this case, we would talk about the interval in 2 weeks between the sessions. Also, I would not recommend you to start the treatment of such kind of patients with peelings or mesotherapy. So from my point of view, the first step of the treatment should be home care, correct home care, and it should be not less than for a month. So in a month, you can evaluate what is happening with the skin, how it reacts towards the cream which you are using at home, and only after that, step by step, you can start using professional treatments like peelings and mesotherapy in your clinic. Also, of course, the strategy of treatment will depend on the type of the skin of patient. So if it's oily skin, then yes, we have to use some acids in the treatment. If this is dry skin, then vice versa. Our treatment should be as mild, as soft as possible, and not containing any kind of the acids. So first product which we are going to discuss and which we can really recommend to our patients to use at home is Innoderma Sensitive. This is very light face cream for daily use, but actually it can be used during the day, it can be used during the night. There is no some specific product for night. That is why I usually recommend to my patients to use this product both in the morning and in the evening after cleansing the skin. And this is the best product for sensitive and hyperreactive skin because of the specific ingredients that it contains. And the specific ingredients are panthenol and hyaluronic acid, and no more. So here you understand that in this product, there are no any irritants. So it cannot provide any kind of unpleasant sensations, but it's normal if the patient will tell you during the first week, then yes, I have some feelings, I have some sense of sometimes burning, they can say, but this is not associated with the cream. This is associated with the damage of the skin barrier, and everything which is applied on the face gives some kind of feelings because of the disturbing of the end of the nerve ends. So this is fine, but in 1 week, in 10 days, all these sensations will disappear, so don't worry. One of the main ingredients is panthenol, and you know that panthenol is the ingredient that can penetrate deeply and stimulate the proliferation of the fibroblast, which also will stimulate the synthesis of the natural hyaluronic acid in our skin. It helps to restore skin protective barrier. That is why panthenol is one of the most usable ingredients or products after different kind of burns, after UV radiation, for example. It has the ability to repair and regenerate the damaged skin. So that is why panthenol would be the ingredient which really will help to protect the skin. Hyaluronic acid is polysaccharide that can, you know, that it has moisturizing ability. It has the capacity to bind a lot of molecules of water. Here we are mostly interested in the prevention of the transepidermal water loss, and we understand that it will help our skin to function in the correct way. Also, it enhances the skin barrier function because it prevents the penetration of the potential irritant agents. It improves skin tolerance. It eliminate dryness. So these are the main two ingredients which really will help to restore, to regenerate the skin. And in a month of using this product, we can evaluate the condition of the skin, and we can start to work with the patient in the clinic. We can offer some professional treatments. Also, by the way, talking about the cream, it is very important to pay attention to the jar in which is this cream. So here you cannot see, but I'm sure that if you started to work with these creams, you saw the package, and you understand that on the top of this jar there is a specific membrane. And it is not possible to put just your fingers, your hands inside the jar and take the cream. You just have to press on this membrane and a drop of cream will appear. It's extremely important for the patients with the sensitive skin. So it means that microorganisms and any kind of pollutants will not get into this cream. So it's completely safe, and of course for such kind of patients it's extremely important not to have the contact with them with the environment. So what we can recommend to our patients to do during the professional treatments? We have two main products. These are sensitive peel, and this is product sensitive ID, which we can inject. Let's start with the sensitive peel, which contains gluconolactone, lactobionic acid, and pantothenic acid. As you can see, the concentrations of the main ingredients are not very high, and the main ingredient, which is gluconolactone and 25%, is a very, very soft and mild ingredient, which will not irritate the skin, or it will irritate it not in the aggressive way. So the protocol of the treatment is very simple, and if you have been working with the products of Innoaesthetic, you know actually the protocol, because the first steps of the treatment are almost the same. We have to cleanse the skin, and of course, talking about sensitive skin, mostly we will choose soft cleanser, not deep cleanser. Deep cleanser contains 1% of glycolic acid, and sometimes it can be an irritant for the sensitive skin, but soft cleanser would be a perfect product in order to cleanse the skin before the treatment. Then degreasing solution. So you know that the step of the degreasing is extremely important in order to obtain really good result after the peeling, because without degreasing, peeling will not penetrate in the will not penetrate evenly into the skin. Sometimes it will not penetrate at all. It will be just neutralized on the surface of the skin. Sometimes there are questions about really dry, dehydrated skin and sensitive skin, like why we have to use degreasing solution if the skin is damaged, the peeling will go deeper and so on. But sensitive skin is not always dry skin. Sometimes this is oily skin, because for example, working with acne, we are also working with some kind of sensitive skin, but this is oily skin, and there are a lot of sebum on the surface of the skin. And it means that if you are not using degreasing solution, then the treatment will not go properly. The peeling will not work properly. Also, you pay attention to the active ingredients of the peeling. It's very, very superficial, and these acids can be neutralized in a very easy way. That is why using degreasing solution is extremely important. But working with the sensitive skin, just don't do very intensive movements, like working with the normal skin, with the thick skin. I usually recommend to do it really in the intensive way, to use more degreasing solution. Sometimes I even recommend to use gauze. Here, no, of course, no, we have to be really very delicate with such kind of skin. Sometimes it just touching of the skin with the cotton pads soaked in the degreasing solution, and it would be completely enough for the sensitive skin or for the dry skin, for example. Then we can, after the degreasing, we can apply the peeling itself. It is very good for the professionals that now this peeling is in the ampules. So it means that you are going to just open the products while doing the treatment. You don't have to open like 15 or 30 milliliters bottle, and your product is not connected with the air every time you're going to use it. So having such kind of ampules is really helps the product to work in the correct way anytime you're going to use it. And we are going to apply it in several layers. It can be 3 or 4 layers. And you understand that you as the professional will choose how much layers are you going to use. So you are evaluating the reaction of the skin after every layer you are going to apply. So if you can see that, for example, during the first treatment, you see that the skin is red after the first layer, but usually it doesn't happen. But for example, if you can see it, redness, if your patient is telling to you that the skin is burning, then it means that for the first treatment for this kind of patient, for these patients, this is enough. Maybe next time you will do more, but maybe his skin barrier is still damaged. Maybe maybe it's some kind of period of the menstruation cycle for this female patient. So it's normal. Then you stop your treatment during on the first layer. But mostly you will not see any kind of irritation. You will not hear that your patient feels some unpleasant sensations. Usually these peeling is really comfortable. That is why we are talking about 3 or 4 layers. The interval between the layers is usually 1 minute. So you are waiting just to the drying of the product, and also you ask about the feeling of the patient. So usually they will tell you that as soon as you apply 1 layer or second layer, they are feeling something. Then approximately in 1-2 minutes, they are telling that now I don't feel anything. So it means that the topical neutralization of the acids is also happening, and it's the time to apply the next layer. It will help you to understand when you're going to apply the next layer. When you are applying your last layer, like 3rd or 4th, then you can wait. For example, the average time of application is around 5 minutes, and after it, you can rinse it with water. At the end of the treatment, you will apply skin repair, which is very popular product, and actually we are using it always. We are going to finish any kind of treatments. We are using it at the end as the finished product for peelings. We are using it like neutralizer for some peelings. We are using it as finishing product for mesotherapy treatments because it possesses regenerative activity. It smooths the skin, it calms the skin. And also, as you know, we have different volumes of the product. So we have professional product, which you can use in your clinic. It's like 500 milliliters. And also we have 60 milliliters, which is very good volume for your patient. So after you started to do some professional treatments in clinic, you also can recommend your patient to use skin repair at home. And also there is no problem if the patient with the sensitive skin will use skin repair, because this is the cream mask which really possesses calming and regenerative activity. So here again, you can see the treatment protocol, just how we are going to do it. Before peeling, we are recommending our patient to use sensitive cream for a month. After the evaluation of the condition of the skin, we can start to do peelings and mesotherapy. And if we are talking about the peelings, this is the average quantity of peelings would be 6 treatments, and the intervals here you can see 7 days, but I would recommend you to evaluate the sensitivity of skin, to evaluate the reaction of skin towards peeling, and sometimes the recommended interval between the sessions would be not 7 but 14 days or 2 weeks. Also, now we are going to talk about mesotherapy products, and if you want to combine mesotherapy and peelings, of course that is not always a good idea to combine it in one session, especially for the patient with the sensitive skin. That is why I usually do it like 1 session of peeling, and then 1 session of mesotherapy, then again 1 session of peeling. It means that once a week you will do or peeling or mesotherapy, and in such a way the interval between your treatments would be around 2 weeks. Post-peel. Of course, just after the treatment, you can start to apply Innoderma again, Innoderma sensitive skin again. This is Very mild and soft cream. It doesn't contain any acids. That is why we shouldn't avoid of using it after professional treatment. Even we have to recommend to do it. In order to maintain the results of the peeling, and if your patient really need it, if your patient is living in the climate, for example, with a high UV radiation or cold climate or so on, so you understand that this skin needs maintenance treatment, then you can do you can evaluate the condition of the skin of the patient, and you can do even 4 cycles of such kind of treatments per year. This is one of the results of the treatment of the patient with sensitive peel. And the last product, which I'm going to recommend you to use with the patient with the sensitive skin, is Sensitive ID. So this is actually the mesotherapy which is recommended for the sensitive skin. Here, again, pay attention, we have almost the same ingredients that we have in the cream, that we have in the peeling. This is panthenol and hyaluronic acid, which will restore and protect the skin and also hydrate the skin, and gluconolactone. But what is the difference? With the peeling, we apply, or with the cream, we apply these ingredients just topically. So they will help us to regenerate the superficial layers of the skin. But when we are going to inject them, we are working with the deeper layers of the skin. And this is extremely important, that we will put hyaluronic acid deeply, because using it superficially, you know that the molecule is really big, and usually this is the hydration or of the superficial layers, or this is the occlusive treatment, let's say. So this hyaluronic acid will stay superficially, and it will protect our skin from the transepidermal water loss. But when we put hyaluronic acid deeply, it means that it will work inside the dermis. It will help dermis to bind water inside and protect it from dehydration. So panthenol restores and soothes the skin. Hyaluronic acid extremely hydrates, again soothes the skin, promotes elasticity and softness. So you also provide not just soothing effect, but some kind of anti-aging effect, some kind of hydrating effect. You will see that the elasticity and turgidity of the skin is much more better after such kind of treatments, that the wrinkles are not so deep. And the third active ingredient of this product, which is gluconolactone, will strengthen the skin barrier. It also possesses moisturizing and antioxidant properties, so it means that it will protect the skin from the aging processes and from any kind of irritation and damage from the outside. Here you can see the main treatment protocol. This is one treatment, one session in 15 days, and between these 15 days you can do, for example, the treatment of sensitive peel. Of course, the combining of such kind of treatments will give you much better results and much faster results. And this cycle can be repeated in 4-6 months if it's really needed. As for the technique, of course, you can use any kind of technique you prefer. It can be papule technique, it can be nappage technique, it can be linear technique of point by point, but try to choose the technique which would be less irritatable to the skin of the patient. So sometimes we are starting to do papules, for example, in the lower face, and just doing several lines of injection. You can see that the skin is really, you can see very evident redness. You can see that the papules are increasing in their volume. So then inject the product a little bit deeply with point by point, but with less quantity of product for each point of injection. And usually it would be less irritatable for the skin. Usually after the treatment, your patient will not be very red. He will not feel this burning sensation and so on. Also pay attention to the anesthetics which we are using, because to tell the truth, in let's say 70% of cases of redness and some reactions of irritation and some itching sensation and burning sensation, it can be caused by the topic anesthetics. So if for your patient it's possible to do the treatment without anesthetic, because the treatment is really very fast, it's just 10-15 minutes, especially if you're using the Pash technique, then of course it's better not to use topical creams with lidocaine or any kind of other anesthetics which you are using during the treatment. And here is the video of the treatment. So at first we have to cleanse the skin, and for that reason we are using soft cleanser. We remove soft cleanser. Here you can see sensitive peel, which is in the ampules. So you can apply it just to the skin, or I usually first put the product into the small glass jar, let's say, and apply it from there. Here, Victor is doing the application just with the hands, but you can do it with the brush. It's not a problem. Peeling is very, very soft. So as you can see, there is almost no any kind of reaction of the skin. And of course, we are working not only with the face, but also with the neck with the product. After the time of application, we remove peeling with water. If you want, then again, you can use soft cleanser. And here you can see the injection of the sensitive ID. So it's like the option for the combined treatment, peeling and mesotherapy together. But you can do it in different sessions, and also what is possible, you can do, if you decided to combine the treatment, then it's not a problem if you will do mesotherapy at first and then you will do peeling. Of course, not with the roller. So what do I mean? If you are using roller, then yes, it's better to do it after peeling, because if you will do it opposite, at first roller and then peeling, then of course it will cause the irritation of the skin. But if you are doing injections in the technique like point by point, then after that you can do peeling, and it will not cause any kind of irritation or sensitivity. You can use roller, you can use dermapen. For the sensitive skin, from my point of view, dermapen is even better than the roller because it's the less traumatic technique, and the depth of the injection should be not more than like 0.2 if we are talking about dermapen. So as you can see, this is very, very delicate treatment, but due to it, we stimulate the penetration of the active ingredients to the deeper than superficially. And for the home care, here you can see how we apply the cream. So just a membrane, you press it, and you've got some drops of the cream. Here it's used for finishing treatment, but you can just recommend your patient to use it at home, and in your clinic for the finishing treatment, you can use skin repair without any problems, because skin repair, let's say the volumes of the products are different. So here you can have 30 ml, which is better to use at home. And for your professional treatment and finishing treatment, you can use products with 500 ml. So this was the first block of the product, which are recommended for the sensitive skin. The next would be about xerosis or extremely dry skin. So what can we do here, and what is actually the problem of xerosis? Xerosis cutis, which is extremely dry skin, or skin with hydrolipid deficiency. So actually, mostly this condition is characterized by the reduction of the amount or quality of lipids, which leads to transepidermal water loss. So mostly this is dehydrated skin. This is skin with a deficiency of the natural moisturizing factor. And of course, such conditions lead not only to the dry skin or to some unpleasant sensations of the skin, it can also lead to the more fast processes of aging. The clinical features of the dehydrated skin or of the xerosis of the skin can again be objective and subjective. The objective symptoms are dry, flaky skin, rough skin, dull skin. So you can evaluate it visibly. Also, you can feel it with your hands when you are doing the treatment to such kind of patient. The skin is really rough. There is loss of elasticity of the skin, and usually this skin is thicker. So it's really very interesting that the skin barrier is damaged. Then sometimes we think that some kind of skin should be thinner, but no, this is thicker. And later we will talk about it, and I will explain what is happening with the dehydrated skin and why the layer of the stratum corneum is becoming thicker and thicker in the skin prone to xerosis. And of course, there are some subjective symptoms. So your patients can tell you that they feel tightness of the skin, they feel some kind of itching sensations. Sometimes they can even feel some pain or burning sensations, especially after the some kind of triggers influence the skin. So, and these triggers also can be UV radiation, some kind of climate like wind or frost. It also can cause some subjective symptoms. What are the causes of xerosis? The main problem is usually associated with a protein which is called filaggrin, And filaggrin is really one of the main factors of hydration of the skin, because as you know, filaggrin is starting to be produced in the deep layers of the epidermis, and then it goes to the superficial layers of the skin, and on the layer of the superficial keratinocytes, filaggrin has to be destroyed with the help of proteolytic enzymes. And at the end of this destruction, the natural moisturizing factors should be revealed, and these factors would be responsible for the binding water in the superficial layers. But if there is some kind of alteration in the synthesis of filaggrin, or if there are some kinds of let's say not activity of the enzymes of the skin, which cannot degrade the filaggrin, and natural moisturizing factors are not revealed, that will lead to the dehydrated skin, that will lead to the lack of the moisture inside the skin. So in order to understand how filaggrin is important to our skin, just remember the skin of the patients with ichthyosis. So ichthyosis, this is the severe disease which is caused by the full absence of the filaggrin. And that is why the skin is not like the skin. It's completely dry. It is not protecting. It's not protecting anything, let's say, because it's prone to any kind of not only irritation, but to all kind of damage from the outside. So filaggrin is really extremely important for the skin. And also with the lack of filaggrin, with the lack of water inside the skin, our inner enzymes, our proteolytic enzymes, are not working in the way they have to work. So it means that you know that all the cells, keratinocytes and corneocytes of the stratum corneum, they're connected with each other with the desmosomes, with the specific binds. And for the normal process of exfoliation, these desmosomes should be destroyed by the proteolytic enzymes, and the dead cells should be disconnected from the skin. So this is the normal process of exfoliation. If the skin is dehydrated and proteolytic enzymes are not working in the normal way, they are not working at all, then these binds, these desmosomes will not be destroyed. It means that all these corneocytes, all these dead cells will stay on the superficial layers of the skin. And that is why skin would be rough. That is why you will feel with your fingers, if you touch the skin, that it's not smooth, that it's extremely dry, that it has flaking, it has some kind of exfoliation. So this is just because of the alterations in the hydration of the skin. During the consultation with the patient, there are several factors that we have to pay attention to. This is the age of the patient, the history. He will tell you how long he has this dry skin, with what it can be evaluated. So do the patient connect it with some kinds of climate changes, of some moving to another country, of changing in their home routine, or so what can be it associated with. Also, we have to evaluate objective and subjective symptoms, which we can see or about which the patient will tell to us. And then we will put the diagnosis and we will recommend the specific treatment. So actually, there is a lot of in common with the sensitive skin or xerosis. And the main factors which are in common is the damaged skin. But in the case of xerosis, we do not see this hyperreactivity of the skin. Yes, it's dry. Yes, it's dehydrated. It's never oily, like sensitive skin. It can be oily. In xerosis, of course, not. It always will be dry. It will be dehydrated. It will be damaged. But not always it will be prone to the sensitivity or hyperreactivity of the skin. So here, the main strategy of treatment would be protection of the skin, regeneration of the skin barrier, and hydration of the skin. That is why the first product which we are going to recommend to such kind of patient is Xeroskin Day Cream, which is the nourishing face cream for dry or extremely dry skin. It deeply moisturizes the skin, and at the same time, it's creating like an occlusive film on the surface of the skin in order to protect it from any additional transepidermal water loss. The main ingredients that we have here are moisturizing complex, which is responsible for the hydration of the skin and for the increasing of the holding capacity of water of the skin. It prevents transepidermal water loss, and it replaces some moisturizing factors if you really have the lack of natural moisturizing factors in the skin. It also can maintain the skin firmness and protect it against extreme weather conditions. So it's like it will help the skin to, if the skin really has the lack of its natural moisturizing factor, you're like replacing it with the help of this kind of cream. Again, here we can see panthenol, and we understand that we need it in order to protect our skin, in order to regenerate our skin, because the skin of patients with xerosis is really damaged, so we need some kind of protection. Hyaluronic acid, because again, this is dehydrated skin. Yeah, I've already mentioned that there are some common there is a lot of in common between sensitive and extremely dry skin. That is why some of the active ingredients, you will see that they're similar, but the main differences in these kind of creams is that in this kind of cream, which is recommended for xerosis, you will see a biosaccharide gum, which is the ingredient which has high molecular weight, and it means that it will form a non-occlusive screen on the epidermis. So actually, it will protect the skin from any kind of damage which can be caused from outside. That is why I usually say that this kind of cream would be very good for the winter period for most of the patients, even if they do not have extremely dry skin. This is really a very good protection during the frost, during the wind, so during such kind of climate and weather factors. After some kind of using of cream, like for 2 weeks, from 2 weeks for a month, you can start to do professional treatment. And again, we have two main products for the professional treatment. This is Xeroskin Peel and Xeroskin ID. Xeroskin Peel is the product which was formulated specifically for the extremely dry skin, and it will help us not only to hydrate the skin, but also to get rid of the dry and dead cells on the superficial layers of the skin. So it will not be so rough. Usually after such kind of peelings, you can see that the skin is more smooth. It's like more fresh, not so dull, not so grayish. So I really highly recommend you to use this peeling on the first steps of the treatment of your patients, because after you can choose something which is more active, such some peelings which will go deeply. But for the first steps of the treatment, for the starting therapy for your patient, this is a perfect product. As you can see here, we have several steps of the treatment, step 1 and step 2. These are the main ingredients that we and the concentrations of the main ingredients that we are having in both steps. And you can see that again, this product is very mild, very soft. It will not cause any kind of irritation for the dehydrated skin, and it will just exfoliate the dead cell in a very, very mild way. Pay attention to the pH of the product, which is from 4 to 5. So this is extremely comfortable treatment for your patient, which you can provide even during summer period. The pH of the second step is lower, but second step is really the product which will give you anti-inflammatory properties and which has to go a little bit deeper than the first step. The first step is actually the preparation for the treatment. So the protocol of application is, again, would start with the using of Innoderma or deep cleanser, but of course you understand that in 99% of treatments for the xerosis, you are going to use soft cleanser because the skin is dehydrated, the skin is usually dry. That is why we don't need to apply deep cleanser. Then degreasing solution. Again, yes, the skin is very dry, so we are not going to use degreasing solution in some intensive way. We are not going to use to do some intensive movements, but sometimes it would be enough just to touch the skin with the cotton pads soaked with the degreasing solution in order to remove some quantity of the sebum. And then we are going to apply the peeling itself. You can see that there are 2 ampoules, which are step 1 and step 2. At first, we are applying step 1. We can apply it just with the hands in the glove. As for the gloves, I usually recommend to use not latex gloves, but the best choice is vinyl gloves because they will not be sticky after the treatment. So it's very comfortable to use them for such kind of treatments, which you're going to apply just with the hands. We are going to massage it for 2-3 minutes, and then we remove it with water. In such a way, we can apply from 2 to 3 layers. Again, as for this, with the sensitive skin, here I really recommend you to use not less than 3 layers because it will not cause any kind of irritation. Here we don't have any kind of hypersensitivity of the skin, so it's always not a problem to use 3-4 layers. This is what we have here. The interval between the layers would be again around 1 minute. After the last layer, you're waiting for 5 minutes, and then you can remove the peeling. And actually, you can add the second layer and finish the treatment with skin repair, which we are usually using for regeneration of the skin and repairing of the skin after any kind of treatment. So here is the treatment protocol. You see that we are starting to use xeroskin cream 3 to 4 weeks before. Then we can start do our peelings with the interval of like 7 days. Just after the peeling, again, your patient can use at home Innoderma xeroskin cream. And for the maintenance of the treatment, you can recommend to your patient to do this treatment 3-4 times a year. So 6 treatments, 6 sessions, it's like the full range of treatment for 1 period. But then when you need maintenance of the treatment in 3-4 months, you can again do these 6 treatments, 6 sessions. So this is the result of this xeroskin peel. You can see that the skin is more like more healthy, more fresh, more smooth. And it will never irritate the skin. You can use it all year round. You can use it during summer. That's not a problem. You can use it for all skin types and all ages. The next product is Xeroskin ID, the product which we are going to inject. The main ingredients are hyaluronic acid, dermatan sulfate, vitamin B5, and glycerol. So mostly the active ingredients are responsible for binding water, retain water inside the dermis, for the restoration of the skin barrier functions, for the restoration of the balance of the hydrolytic mantle. Vitamin B5 is responsible for the improving of the functioning of the skin, also for the moisturizing of the skin. Glycerol, as you know, is the ingredient which is responsible for hydration, for the improvement of the elasticity of skin. It enhances the functions of the stratum corneum and improves the barrier function of the skin. And hyaluronic acid, of course, as always, we've been discussing that it soothes the skin, it hydrates, moisturizes the skin, and in such a way we prevent transepidermal water loss. This treatment can be done, we recommend 4 sessions with the interval of 15 days, but you have to understand that it's also possible to do it once in a week. So the interval, like 7 days, would be okay. It's not a problem. You also can combine these treatments in one sessions, like doing mesotherapy together with the peeling. And again, you can choose any kind of technique you prefer: micropapule technique, point by point, nappage technique, and you can do mesotherapy at first and then finish with the peeling, or you can do peeling and then do mesotherapy. It's not a problem because both of the treatments are very mild. They doesn't cause any kind of irritation. They don't cause any kind of unpleasant sensation for your patient, and feel very, very comfortable. So again, cleaning the skin with the soft cleanser. After soft cleanser, don't forget about degreasing solution. Here we have step 1 of the product, putting it into the glass jar and applying it with a brush. And you can apply it in such a way in 3-4 layers. In all the areas of the face. Also, we are working with the neck. And of course, if you need, it can be also applied for the décolleté area. Here is removing of the peeling. Then we apply the second step with the cotton swab. You see that the skin is not red. There is no any kind of irritation or hypersensitivity after using of this peeling. So this is actually the great choice for those patients who usually tells you that, you know, doctor, I don't want to do any kind of peelings because my main goal is to hydrate the skin, and after the peelings I had it before. Usually I feel that my skin is really dry. I don't like this exfoliation after the peeling and so on. So they're afraid of peelings because before, for example, they can have the experience of glycolic peelings, for example, and of course this is not the best choice for such kind of patient. But this kind of peeling, you can use it for patients with dry skin, for those patients who do not want this very active and visible exfoliation, a peeling effect after. There are some questions we have here, like, can we use Xeroskin ID for the scalp? Yes, of course, it's not a problem if you really have dehydrated scalp skin, then for sure it can be used, because there we have hyaluronic acid and all the ingredients for the hydration. So with the, for example, dry seborrhea, yes, it would be indicated. Why removed first layer? So actually, removing the first layer of the peeling will help the second layer of peeling to penetrate deeply. You saw that the first step is mostly like the preparing the skin for the second step. The first step is a little bit more jelly, so it's not so liquid as the second step, and it will work during the first 5, 6, 7 minutes of its application. So it's not so important to leave it on the skin and to use the second step just on it. Remove with water or without? Usually we remove it with water, because without it would be a little bit irritating when you are used dry cotton pads. It's not pleasant and it's not effective, to tell the truth. That is why usually we removed it with water. Also, if you want, sometimes even for more mild removing, but it concerns mostly to sensitive skin, not just for dry skin. So you can remove it with even with the soft cleanser if you want. These were some questions. If you will have more, please write it and I will answer it at the end of the webinar. Then we have ID, which you can inject with every kind of technique you prefer. So here you can see superficial nappage technique. And in such a way, we can work with the whole face of the patient. But working with the dehydrated skin, to tell the truth, I prefer to inject it more deeply in order to put the product just inside the dermis and to retain water inside the dermis. It will give me the effect of hydration just after the first session. Of course, you can combine techniques. So for example, firstly, you can do more deep injections like micropapule technique or point-by-point technique. And like the second step, you can apply the product in this way superficially with an Apache technique. And thus you will be working like on all layers of the skin. You also can use dermapen, you can use derma roller, not a problem. Of course, if you're using the brush technique, you have to wait until the skin will be dry. So we are not removing the products from the surface of the skin. Here again, you can see the jar of the cream, which has membrane. But mostly in real life, we are using skin repair for finishing the treatment. And this cream, we are recommending to the patients to use at home. So I will the right questions, as I can see, about the protocol of treatment, but you have to understand that the treatment is very easy. The treatment is, products for the treatment are very soft and mild. So there wouldn't be a mistake, for example, if you will not remove something. For example, when we are using sensitive peel or when we are using xeroskin peel, actually, if we will not use water at all, if we will just use cream for finishing the treatment, and your patient will wash the face just at home in 2 and 3 hours, nothing bad will not happen with the skin, because it's really very soft. And sometimes when I see that, for example, I'm working with the sensitive skin but oily skin, and I know that this is not the first treatment, that also my patients started to use home care, and this is like not the first phase of not the first steps of the treatment of such kind of patient, and I want to be more intensive. I want the peeling to go more deeply. I want to work with more time of application of the peeling. I can finish the treatment just with skin repair, and my patient will cleanse the face in 2 hours. That is not a problem. The other question is if there is any sense not to remove the peeling with water. So, there are a lot of different kind of applications which can be done by different professionals, and with such kind of peelings, you can do your own protocol, and it would not be wrong. But just my opinion, when you ask, do we have to cleanse it, any kind of peeling with the water or with the dry cotton pads, I will tell you with the water, or with the cotton pads which are soaked in the water, just because it's more easy. With the dry pads, they will be sticky to the face. It's just not comfortable. That is why it's better to do it with the water. The question about aftercare, just write please what kind of aftercare do you mean? Are we talking about skin repair, and how much do we have to use it after the treatment, or how much of home care for your patient have to use during, so write some details about home care products. So about home care products, I would say that minimum period of using home care would be 2 months. And in 2 months, you can add something to the home care. But if the skin is really dehydrated, if the skin is prone to the damage, to the transepidermal water loss, then your patient can use, for example, xeroskin for the whole year round. It doesn't mean that it would be their only product at home, no, but it can be their basic product at home. So minimum 2 months, maximum during a lifetime, because there are no aggressive ingredients in these creams. They will not cause any kind of irritation and kind of damage. We just sometimes add some extra products after 1, after 2 months, when the sensitivity of the skin is lower, when the skin is hydrated, because as you can see, the formulation of the creams are very simple. So we don't have here some epigenetic ingredients. We don't have here some peptides which will stimulate the activity of the skin, the activity of our fibroblasts. But the patients want to have something anti-aging. They want sometimes, maybe they have also the problem of hyperpigmentation, for example, and these creams will not give you the solution for that problem. So sometimes we have to combine different kinds of products. These, I guess, would be the answer to your question. The other questions you can write and we will discuss them after. Now let's go to oily skin and acne-prone skin, which, you know, is a very really challenging problem. Also, I'm sure that if you are doctors, you are working a lot. If your clients are doctors, so they are working a lot with the patients with the acne. Almost every day we have such kind of patients. And Innoaesthetics really have the full range of the product for a solution of different kinds of acne, of different types of acne, of different ages of the patient. And it's really interesting to discuss it. So acne is we can refer to acne as to the inflammatory changes of the skin, which can be triggered by acne bacillus. And this is skin condition which is characterized by sebum retention. It is very important to understand etiological factors, to understand pathophysiological factors of acne, because only understanding that we can understand what kind of products we have to use and in what case we will really get very, very good results. Why is it important to treat acne? I think everyone understands that, first of all, it's important to treat it because of the prevention of the scars and hyperpigmentation, which can be the complications of acne, like post-acne scars, post-acne hyperpigmentations after the inflammation. And also, acne, of course, is the reason of many psychological problems of the patients, because you understand that usually young patients and socially active patients are prone to acne. So this can be 15 years old teenagers for whom, of course, the problem of acne is really a huge psychological problem. Sometimes they cannot communicate with the people around. They do not like themselves. So they become more closed, and in such a way, a professional like a good dermatologist, a good esthetician, which will help to such person, he will be not just doctor for the skin, doctor for the beauty, he will be also some kind of psychologist for for such kind of a patient. So it really will help to avoid a lot of psychological problems of the patients. Talking about older patients, the same. It's when you are 30, when you are 35, and you already forgot about acne which you had 20 years ago, and then something happening, some hormonal disbalance is happening, and the person who has to go to office every time, who has to meet with the clients every day, she has acne. Of course, she will choose the best products, the best professional treatment, the best home care products in order to treat this problematic. So it's really a big challenge. So first, we have to understand the etiological factors, and one of the first etiological factors is genetics. So when we see that one of the parents had acne in his life, it means that the child, there is a lot of chances that the child will have it. If both parents had acne, there is more than 60% that their child will have acne during some periods. Especially it is when we are consulting a patient, it is very important to ask about the acne in the anamnesis of mother, because there are higher risks to have acne if mother has acne. What else is important to evaluate when we are talking about acne? First of all, here you can see different kind of lesions which we have during in different types of acne. Here is the healthy hair follicle. Here you can see the sebaceous gland, which is synthesizing sebum, and which normally has to go up to the surface of the skin and protect the skin from the damage. But because of some factors, this process can alter, and for example, we can see closed and open comedones on the surface of the skin. This is usually, we refer to this pathology as to comedolytic acne. In this case, sometimes it just, you have to do facial, you have to do cleansing of the face and extract these comedones. So here we are not saying about inflammation. But if you see papules and pustules, that means that we are working with the inflammation. So here we need to use also some anti-inflammatory ingredients or anti-inflammatory products, which we are going to discuss later. And this is, from my point of view, this is like the main picture, the main slide, the main information that every professional has to understand. If you remember about all these factors, it means that you will be successful in the treatment. So if we know that the main reasons of acne are excessive sebum production, that means that we are going to use the product which will control the sebum production, which will decrease the sebum production. We remember that the next step of the formation of acne is the hyperkeratinization with follicular clogging. That means that we have to use the products which will control the keratinization and which will stimulate the processes of the exfoliation and removing of these exfoliated cells on the surface of the skin. The next step of the formation of acne is bacterial colonization. So it's extremely important to use some not only anti-inflammatory, but also ingredients which possesses antimicrobic activity. So usually it can be mandelic acid, for example. And because of the bacterial colonization, we have to work with the release of inflammatory mediators, which are actually released. Some of them are released just by these bacteria. So here we have to use some anti-inflammatory ingredients. And only with using of the complex of the products or complex of the ingredients, your treatment really will be full and you will get good results. So just using some exfoliants will not give you the result, because exfoliants maybe will solve the problem of hyperkeratinization, but not working with the excessive production of sebum. The problem of hyperkeratinization will still exist, because mainly or one of the reasons of hyperkeratinization is the disbalance in the lipids of the skin. So every step of the formation of acne, they are like connected with each other, and it's not possible to treat only one of them. You have to treat all of them. The classification of acne. So with what kind of patients do we work? First, this is not inflammatory acne. We can see only closed and open comedones. You've seen the picture. The main difference between closed and open comedones would be their color, let's say, because usually closed comedones are white, open comedones are black. By the way, don't think that black open comedones have this color because they are dirty or something like that. No, it's just because of the oxidation of the pigment melanin, which is happening inside the hair follicle. So we have a lot of pigmented keratinocytes inside, actually. And inflammatory acne. Inflammatory acne can be also of different types, of different stages, and we have to evaluate the severity of this acne, because with mild and moderate acne, we can work like aestheticians, we can work like just with the topical treatment. But if we are talking about severe acne, we cannot treat it only topically. We cannot treat it just with peelings or home care. So here, maybe it is important to have the consultation of a dermatologist. Maybe you are a dermatologist, but if not, the esthetician have to send the patient to the dermatologist, because here is important to evaluate, do we have to recommend to the patient to use systematic retinoids or systemic antibiotic products, antibiotic medicines. We are working, or estheticians are working with papules and pustules. No problem. We can deal with that topically. We can deal with that with use of peelings and mesotherapy products and home care. But if you see that there are nodules, then it's important to have the consultation of a dermatologist, because nodules in 80% will finish with the post-acne scars. They will finish with post-acne hyperpigmentation. So here it's extremely important to work fast to suppress this inflammatory reaction of the skin as soon as possible, not to have the complications post-acne. So what we are going to recommend to our patient, of course, you understand that we can discuss the problem of acne the whole day. And today we have to talk about several lines. That is why I'm not talking about the whole step of the pathophysiology or etiology of acne. Here we have to concentrate about the whole line and to understand what kind of products we can recommend. But of course, we can organize other webinars concerning every kind of pathology we are talking about today. So firstly, home treatment. Just after the or during the first consultation with your patient, of course, we are recommending from the first day some professional treatments, but it's not possible to treat acne without proper home care or proper home treatment. Always explain to your patient that the professional treatment, yes, is very effective and very active, but professional treatment maximum we are doing once a week. Home care, your patient will do twice a day every day during 4 months approximately. For someone, it's years, not the question of months, the question of years. So that is why it's not possible to treat acne without home care. First of all, you have to discuss with your patient what kind of products they are going to use at home during the whole period of the treatment of acne. And these would be two main products: AKN Beta Purifier Day Gel and AKN Beta Purifier Night Gel. I really love these products. AKN Day Gel is more, let's say, more new product. I think that you know AKN Beta Purifier Night Gel, that before we were using only that product. So the main ingredients that we have here are mandelic acid, niacinamide, salicylic acid, glycyrine, zinc, sulfur. These are the main products that will help you, as you see, like the combination of products, which will help you to work with every step of the pathogenesis of acne, which will help you to balance the synthesis of sebum, which will help you to work with the extra-keratinization process, also which possess anti-inflammatory properties. This is the product which you, with which you are already familiar with, is AKN Beta Purifier Night Gel, which contains mandelic acid, azolaglycine, salicylic acid, and niacinamide. And this is a little bit more active product. That is why it is recommended to use it during night. And this home treatment, I really highly recommend you. When I'm working with teenagers, with really young patients of 12, 13 years, even if they have acne, we have to understand that their skin is very sensitive. So we cannot just start with some kind of peelings or mesotherapy, because I have the experience of, unfortunately, some kind of complications after the peeling when I didn't prepare the skin of teenagers properly. So after that, I really started to work with them a lot before the professional treatments. And I started to recommend them to use at first Beta Purifier products. It was actually this night gel, because before we didn't have day gel. And I've noticed that, for example, after months of using AKN Beta Purifier Night Gel, the condition of the skin of these teenagers is much better, and sometimes we really even didn't need to use any kind of peelings, because the result of the treatment which they use at home, actually it's not a treatment, it's just a home care without any side effects, because here we don't have retinol. That is why we can use it for the patient of different ages. Here we don't have like very high percents of the active ingredients that will give us exfoliation or redness or some unpleasant sensations. So I really prescribed a lot, recommended to a big amount of patients to using Beta Purifier Night Gel, and it gives me perfect results. If I see that, so for those who are 12, 13 years, I'm not going to do mesotherapy, and I can see that in a month it's completely enough to use this product. Then, for example, I recommend to the patient to stay with this night gel, or now we also have day gel. So to stay with these products at home, but after, when the quality of skin is better, when the condition of skin is better, there is no sense, or there is no need to use it every day. So then you can like use it every 2 days, then several times in a week, for example, and to add to your daily routine some hydrating products. If the skin of the patient is really oily, thick, with comedones, for example, so there is no inflammation, but there are a lot of comedones. This is the patient who is coming to you to have facial several times a month. Then, of course, for them, such kind of products would be the main for their daily routine, and they will tell you that the quality of skin after using these products is much better. It's not so oily. It's not so shining. They don't like this shining effect. So I'm sure that your patient will be satisfied with the results, and also you as a professional also will be satisfied. If we are talking about not teenagers, if we are talking about the skin of more aged patients, who it could be from 18 years to 35 years. The patient who already had some professional treatment before, who had some peelings, or who had some acids at home before the treatment, of course, you can do them professional treatment like peelings. And fortunately, Innoaesthetics really has different kind of peelings today. So it's not only like it was before, mandelic peeling. Here we have skin recovery, we have acne peel, which we're going to discuss today, and also we will discuss the differences between these peelings. So the main effect that will give you such kind of home care, they provide anti-comedogenic effects. They decrease the activity of the enzymes which are responsible for the lipogenesis. So in such a way, we can balance the lipid content in the sebum of the skin. We can block or we can balance the differentiation of the sebocyte, which means that we will balance the production of the sebum also. What peeling are we going to discuss as like the first step of the treatment? Here is acne peel, which is the new product. Here you can see that the main ingredient is mandelic acid, which is 35%, 5% of salicylic acid, and 1% of pyruvic. So what effect will you get after such kind of treatment? Of course, the main ingredient, mandelic acid, it will give you very strong anti-inflammatory effect. 5% of salicylic acid is responsible for the effect of the keratolytic effect. So it will help you to work with the excessive keratinization of the cells. The protocol of the treatment is as follows. As usually, we are going to use soft or deep cleanser, and mostly this would be deep cleanser, because usually, not usually, but always patients with the acne, they have oily skin. Then very important step and obligatory step which we have to do is the using of the degreasing solution and application of the acne peel, which can be applied from 2 to 4 layers. It can be applied with the cotton swab in such a way it's much more easier to control the effect of the peeling. Again, we are talking about from 2 to 4 layers, but you are responsible for or dermatologist, esthetician is responsible for the result of treatment. So it depends on the age of the patient. It depends on the preparation of the skin. So did the patient use some acids before, or is it the first treatment? Also, for example, you decided to combine professional peeling with the facial, with the cleansing, let's say. So we understand that, of course, the penetration of the peeling after facial cleansing would be deeper, because usually facial cleansing is more or less traumatic, especially when we are working with the patient with the acne. That is why maybe it would be enough to put only 1 layer. So you have to evaluate the reaction of the skin, you have to evaluate the condition of the skin and decide how much layers do your patient need. At the end, we can use skin repair. We can use also refresh mask. To tell the truth, refresh mask we can use after any kind of treatment. But we usually talk about refresh mask in acne patients because these patients, they don't like oily products. They don't like masks. They like to finish the treatment with some kind of sebum. They like something light without this shining effect. So in this case, if your patients want something really very light texture, it could be refresh mask. They will like it. The treatment protocol which are recommended to the patient, you can start with the home care with the using of AKN day and night gel. Then in 3 weeks, in 1 month, you can perform 6 sessions of peelings with the interval 7 days. Then after these peelings, approximately in 1-2 days, your patient can start to use AKN day and night gel. It's not a problem, even if they contain acids. There would not be a lot of irritation of some kind of redness after it. So yes, recommend them to use it. And such kind of treatment can be done several times a year, like 4 cycles per year. What I would like to mention. So let's, because there are a lot of questions about the difference between when we have to choose skin recovery and when we have to use AKN peel. It was like before when we have to use Mondelez and when we have to use skin recovery. In AKN peel, the main ingredient is mandelic acid. So it will give you mostly anti-inflammatory effect. In skin recovery, the main active ingredient is salicylic acid. So the main effect that you will get here is more keratolytic effect. And mandelic acid also we have in less percent. So from my point of view, AKN peel is more mild peel, is more soft, is more for the first steps of the treatment of acne. So just to deal with the inflammation, to work with younger patients, to work with younger skin, with more sensitive skin, to combine together with the facial cleansing and so on. But skin recovery is more active product. This is like for the second step of the treatment of acne. As soon as we have less inflammatory lesions, but we already have some post-acne scars, we have some uneven skin tone, or this is like not sensitive skin, not thin skin, very thick skin, the person who already had before some retinol peelings, some salicylic peelings in high concentration, then of course you have to choose skin recovery. Skin recovery is amazing product. I really love it. Because it's again layer dependent peeling. You can choose to how many deep you want to go. You can choose how active or how aggressive you can be. So it's very potential peeling, but it's like the second step. It's more active and it can be more deep treatment. So there are some schemes that show you why we are using azelaic acid, mandelic acid, resorcinol. What do they give to you and how and why they are so active? So I've already mentioned that it's important to work with all the steps of the pathogenesis of acne, and using azelaic acid we are going to reduce the activity of 5-alpha reductase, which is the enzyme responsible for the transformation of testosterone into his active form, dihydrotestosterone. And because of this transformation, the production of the sebaceous glands, of the sebum by the sebaceous glands, is rising. So using azelaic acid, we are going to suppress the activity of the dihydrotestosterone, and also we are going to suppress the production of the sebum. Using mandelic acid, we understand that we are going to have anti-inflammatory effects. So actually, this is one of the main ingredients that we are interested in working with the papules and pustules. And resarsenol and salicylic acid, by the way, also possesses very strong keratolytic effect. That's why we are going to use it in order to balance the keratinization process in the skin. The treatment protocol of AKN peel is 1 session in 15-21 days. I can tell you that actually you can use it even every week. So it's not a problem. Even for young skin, just evaluate how many layers do you need, evaluate the reaction of the skin. So usually in 1 week, you can meet your patient, you can ask what kind of exfoliation did they have this exfoliation, what was the period of rehabilitation. But this is really very gentle peel that will not give you any kind of side effects, that will also you will never get any kind of complications, adverse reactions, and so on. This is also the kind of peeling which I'm using during summer, because patients have acne during whole year, and during summer, skin recovery in the some very sunny areas can be a lot for the patient, but using AKN peel is not a problem. You can do it during all year round. From 2 to 6 sessions, here what is important, 2 sessions is never enough for a patient with acne. So 2 sessions is just in the case where when other sessions will be done with the other peeling, like skin recovery or lightening, which contains retinol. So pay attention to that. These peelings don't need any kind of neutralization with a specific neutralizer, which usually, for example, glycolic peelings need, causes mild desquamation. So this is mainly the most information you have to know about AKN peel. And the second product, which we have here for the full range of the line for the treatment of acne, is AKN ID. This is the product which we are going to inject, and it contains pyruvic acid, zinc, niacinamide, melilotose, and peptides. So of course, this is the product which is going to boost all the effect of peelings. From my point of view, so I recommend you, and I prefer to start with peelings. At first, I get the first results with peelings. They give me faster results, and only then I start to use AKN ID. So when the skin is more clean, when I mostly treated all the inflammatory elements, then I started to work with AKN ID in order to improve the quality of skin, in order to prevent post-acne hyperpigmentation or post-acne scars. So I prefer to do like that. The main ingredients that we have here, pyruvic acid is a powerful keratolytic product, and also pyruvic acid is like the ingredient which has given the energy to the cells to have the ability to function in the right way. Zinc, as you know, is one of the most important coenzymes in mainly all the processes which are happening in the skin. That is why here we need zinc in order to maintain immune response, in order to inhibit the proliferation of the Propionibacterium acne. Also, zinc possesses activity of the inhibition of 5-alpha reductase, which is also important in order to balance the activity of sebaceous glands. So really, it will help us to obtain very good results. Niacinamide is the ingredient responsible or taking part in the energetic metabolism, so it will boost the activity of the other ingredients. Here is anti-inflammatory ingredient Mellotus officinalis. That is why the product can be used also with the inflammatory acne, but I think that first you have to work with pills, so you will remove some kind of these inflammatory lesions, and if you need, you also can inject ID and peptides. So as you know, peptides are specific protein molecules which can stimulate something, or which vice versa can block some reactions, some processes. Here, the peptides that are in the product, they are responsible for the increasing of the and strengthening of the immune system of the skin, and also they're responsible for the reduction of the inflammatory activity. Of course, peptides will give you very fast results because they are working really in a fast way. Treatment protocol. So what I would like to mention, from my point of view, it is recommended to use this product not with roller, but with the needle, maybe with Dermapen, because Dermapen gives you the possibility to work topically, so you can avoid some areas where you can see the inflammation. Yeah, I hope you understand that it's important not to put the needle into the papule or pustule and then to work with that needle with the other areas of the face. So here we have to remember about that, and usually we are working near the inflammatory element, but not just inside it. That is my recommendation. We can do like from 4 to 5 sessions, the average quantity of session, and they can be done between peelings. It's also possible. If you want, you can combine peeling and mesotherapy in one session. That is also can be done. But usually I do it in different sessions, because peelings I do it by itself, or I combine peelings with facial cleansing, facial cleaning. So here we can use deep cleanser, because usually the skin is oily. By the way, also, it's better to recommend your patient to use deep cleanser also for cleansing skin at home. Because sometimes if your patient is using some mild products for the cleansing, they are complaining that even after cleansing, they feel some oily skin, they don't feel that it's really clean. So deep cleanser will give them the sense of really clean skin. So in such a way, we are going to apply several layers. Don't forget that acne-prone skin is always sensitive skin, always. It's oily, yes, it can be thick, yes, but it's damaged and sensitive skin. That is why it is important to evaluate how many layers you are going to apply. Because for some patients, you will apply 1 or 2 layers, and for them it will be completely enough. For the other patients, you will apply 4 layers. You can see that the patient feels some burning sensations, and so as soon we are going to apply water. This is always like that. So after using skin recovery, after using AKN peel, during peeling, yes, they sometimes feel some burning, but then in 5 minutes it disappears. Patients are feeling comfortable, don't feel anything, but then you are going to apply cream for finish the treatment, or for example, you are going to wash off the peeling with water, and they are telling that again, I'm feeling some burning sensation, sometimes even more than during peeling. It's normal reaction. Don't be afraid. It will last just for 2-5 minutes maximum, and it's because of the difference of pH between cream, water, and peeling. So the pH of the skin after using peeling is very low, and then you are using water or you are using cream with the much higher pH, and these differences in the pH causing this reaction, this burning sensation. So don't be afraid, that's normal. That's just because the pH level is changing, and it will last not longer than 3 minutes approximately. Again, here you can see that AKN day gel is using for the finishing treatment. Is possible to do, but I've already mentioned that in real life we usually finish with acne, with the skin repair or refresh mask, which acne-prone skin patients prefer because of its light texture. So that was information about AKN, peel, and oily skin. The questions that you have, what difference between AKN and skin recovery, I've already explained. Mandalage, same AKN peel, yes, they are very similar, but this is the new line where AKN was formulated, let's say, on the formula of Mandalage. So I don't know how it will be in future. There will be Mandalage, but Mandalage now we are referring as to the peeling as we are going to use for young patients with the let's say first steps of the photoaging processes, like the peeling, which will help us to prepare the skin for the further treatments and so on. But yes, AKN peel is similar to Mandalage. Proper time to use peels for patient on raw cutan. Proper technique for using AKNID. Inject in the pimple or around it. So I recommend to inject or around pimple or under pimple, but not superficially, just in the pimple. If you want to do it, yes, it's possible. You can do it, but anytime you are injecting into the pimple, you have to or to work only with the pimples. So don't use the same needle for healthy skin and for pimples. But to tell the truth, I don't see a lot of differences between injecting just into it superficially or to inject under it. The only differences is in the painful sensations. So to inject under is less painful, but the result would be the same, anti-inflammatory properties. Proper time to use peels for patients on raw cutan. To tell the truth, I don't recommend to use such peelings on the patients for raw cutan. Now the latest studies shows that peelings based on, for example, azelaic acid or mandelic acid, they can be used for such kind of patients. But this is like the latest information. I think that there are no so much evident result that really we can do it. That is why I would recommend you to use it just after Roacutan, when your patients stop using that. And you have to evaluate the condition of the skin, because if the skin is extremely dry, the only on Roacutan, during using Roacutan, the only what esthetician can do to the patient is to do some hydrating treatments, because you know that the sebaceous glands are blocked, the proliferation, the synthesis of the sebum is decreased, and topically to use any other peeling, of course, it will lead to extremely dry, dehydrated, and sensitive skin. That is why just wait the end of the using of Roacutan, and also evaluate if the skin is not dehydrated and is not extremely dry. Then you can start to use peelings. Question on Roacutan, what is the proper time to do peels? Stop Roacutan for how long? So usually minimum 1 month. Sometimes we need 2 months between Roacutan and peelings. The exact technique of using AKNAD. My recommendation is to do it like point by point, not with the dermaroller, because dermaroller is not topical application. It's like application for a big area. But using needle point by point, you can choose in what point you will inject it. You will inject like 0.03 milliliters to every point of injection. You can inject near the pimples, you can inject under them. So point by point is the most precise technique to work with the patients with acne. I hope I answered all the questions about acne. There is also a question, as I can see, about xerosis from Turkey. We are getting some questions from customers in xerosis ID. Is there a real need for a specific mesotherapy for dull skins or xerosis? As all mesotherapies exist for moist, can't we use a normal mesotherapy? There are, of course, you can see that hyaluronic acid is one of the main ingredients in more than a half of the products that we have in Innoaesthetics or any other brands. But the concentration of hyaluronic acid and other active ingredients is different. The molecular weights of hyaluronic acid is different. So, for example, we can use for hydration matrix, and we can matrix, or we can use for hydration, let's say, fill up. They both contain hyaluronic acid. They are both for hydration. The result will be different, of course, because completely different concentration, completely different molecular weights. Fill up will bind much more water. For dehydrated skin, for deep wrinkles, we will use fill up. For the patient who is prone to swelling, like have bags around the eyes, who has lymphostasis, I cannot use fill up because it will bind more water. I have to use matrix, which contains not 1% or 1.2%, which contains 0.2% of hyaluronic acid of lower molecular weight, which will not give me the swelling effect. So the same is with with xerosis. Yes, of course, you can use any other product with hyaluronic acid. But here we have specific ingredients which not only hydrate, but also which restore the skin, regenerate the superficial layers of the skin, which protect the skin from the transepidermal water loss. So this is more specific. For all these lines were created to have a specific treatment for your patient. Also, I would like to, so what you can tell to your doctors, or what I usually tell to the doctors, what I really like, when you are talking to your patient and you are putting the diagnosis that you have sensitive skin, or you have rosacea, or you have, I don't know, acne. For patient, it is extremely important that you will show him the products that adjust for his problem. So you are telling you have sensitive skin, and I'm not going to inject you, I don't know, hyaluronic acid or vitamin O. I'm going to inject you product sensitive skin. He is going to use at home sensitive skin cream. We are going to do peeling just for sensitive skin. So it tells to the patient that he has really individual treatment. That is also helps the doctor to communicate with his patient, to really have the trust of patient, and patients usually feel that they have very, very individual approach with these kind of doctors. So this is like more marketing, but it's also important. This is like the name of this treatment is also very important. And the last products which we are going to discuss is the products for rosacea, which is also not an easy skin condition, let's say. So we know that there are 4 clinical subtypes of rosacea. We are not working with the erythematous rosacea, with ocular rosacea, which are mostly surgical problems. We are working with the erythematotelangiectatic rosacea, which is also called cupirosis, or papulopustular rosacea. So this is the 2 types which estheticians and dermatologists are mostly working with. What we have to understand about rosacea. So it can be the problem, the issue for the young skin, also for the aged skin. So here age really doesn't make any sense. Sometimes there are some burning sensations, but not really very often. Very rarely the patient can tell that they have itching sensations, but mostly all the symptoms of rosacea you can evaluate just because they are visible. You can see or small capillaries on the face, or you can see redness on the face, especially in the middle face, which is accompanied by some at first papules, but then it could be even pustules. So here it's important to differentiate the problem with acne, for example. But always rosacea would be a sensitive skin and usually oily skin. So rosacea mostly is not dry skin, is mostly oily. Really, a lot of people are suffering with the rosacea or cupirosis. I'm also sure that you had such patients. You can see them almost every day. And we know that there are several triggers which can lead to cupirosis or rosacea, or which can stimulate the like activation of the process. So usually these triggers are heat, damaging cold, ultraviolet, foods and drinks. Again, they're almost the same as with sensitive skin, but also here we have food and drinks. So we have to pay attention to smoking, and we of course have to recommend the patient not to smoke, because smoking leads to the weakening of the walls of the blood vessels. Not to eat spicy food, not to eat or to drink very hot food and drink, and not to drink a lot of alcohol or red wine, because these are extremely strong triggers of the rosacea or cuperosis. So talking about heat, of course, such patients are not recommended to tan, are not recommended to go to the sauna, for example, because it leads to the development of the cuperosis. But of course, none of the triggers can be avoided. And to tell the truth, if we can control somehow food or alcohol, but heat, if you are living in the hot country, you cannot do anything with that. You cannot just move to another country because you have cuperosis. Talking about smoking, yes, it's easy to say you have to avoid smoking, you don't have to smoke, but do a lot of patients really stop smoking just because doctor recommended it? Almost no one. So that is why it's important to work with this patient, to recommend them proper home treatment, and to explain to the patients that usually all this treatment is not for like completely healthy skin and to just stop the problem of cuperosis of rosacea. No, it's just to maintain the quality of skin, is just to try to prevent the development of the process, let's say like that, because if the patient really has weak walls of the blood vessels, if in the early ages you really can see some cuperosis in the mid-phase usually, it means that this process will progress. So our strategy is just to prevent the fast progress of the process. So here, what are the main, we've discussed the main triggers, the main pathophysiological steps of the formation of the cuperosis, of the rosacea, are expression of the PAR2 receptors or PAR2 receptors, which are located on the keratinocytes. Also, it is known that toll-like receptors are also involved in the inflammatory processes which are associated with the rosacea. So the treatment which we're going to use should be focused on the depression of the activity of this kind of receptors. Also we have to try to avoid triggers which are stimulated these receptors, like spicy food or UV radiation, for example. Most of this receptor will promote the activation of catalycidin, and it will stimulate the inflammatory processes, and after these inflammatory processes will lead to the formation of papules and pustules. So also due to the stimulation of different kind of triggers, which I've already mentioned, we have the increase of the release of the substance P, which is mainly responsible for the activation of the mastocytes, for the release of the histamine, and again for the inflammatory processes. So this problem also can be associated with genetics. Here is the good but not very easy scheme how all the triggers are influences at first keratinocytes, and then the receptors of keratinocytes like PAR2 receptors or toll-like receptors are being activated, and how they are starting to produce all the pro-inflammatory interleukins that will will activate a lot of processes already inside the dermis. So the process starts in the epidermis, but then it goes deeper. It goes to the dermis where the blood vessels, where the capillaries are actually going, and they are influences the walls of the blood vessels, which are prone to inflammation caused by these triggers. And in such a way, we can see the problem of rosacea. We can see these red capillaries. We can see inflammation on the skin, and so on. So for rosacea, we have specific redness cream, which contains natural extract complex, cacao butter, dextran sulfate, lactobionic acid, and the complex of ruscus, aculeatus, ginkgo biloba. So those ingredients which will help to strengthen the wall of the blood vessels. And to improve the quality of capillaries and any kind of blood vessels. Natural extract complex are the flavonoids, which reduce the hyperreactivity of the skin and provide different minerals which are needed for the balance of the skin. Also, they strengthen the walls of the blood vessels. In such a way, they are reducing redness. Cocoa butter, this is a very strong antioxidant. Also, this is the oil which possesses very strong anti-inflammatory properties and possesses also soothing and restorative properties for the skin. Dextran sulfate is the anti-inflammatory ingredient that protects the skin from the UV radiation and can promote the turnover of the cells. Lactobionic acid is the very, very mild acid, which is one of the strongest antioxidants for the skin. Also, it makes it stimulates the increase of the production of the collagen in the skin and provides the protection from the extra water loss. These ingredients, I'm sure you are familiar with: toxirutine, ginkgo biloba. So again, this is antioxidant activity, anti-inflammatory activity, and extremely strong protection of the walls of the blood vessels. So I usually try to recommend to such kind of patient who have cupirosis, who have rosacea, also to take some supplements which will contain ginkgo biloba or toxirutine, or vitamin C also, because these active ingredients which will be taken from inside, they really will help to stop the progressing of this problem. What we will do professionally for such kind of patients, and why. So here is the new peeling, which is called redness peel, which was formulated specifically to improve the condition of the skin barrier, to reduce inflammation, and of course to improve the quality of skin. Pay attention to the concentration of active ingredients and to these active ingredients. These are salicylic, mandelic, and lactic acid, and not more than 5%. So we will get anti-inflammatory properties due to mandelic acid. We will hydrate the skin due to lactic acid, and a little bit of salicylic acid, which possesses keratolytic effect, but after such peeling, you will not see some really exfoliation. It can be very, very mild. At first, we cleanse the skin with Innoderma soft cleanser, then we degrease the skin as usually. Then we have to apply redness peel in several layers, from 2 to 3 layers. and at the end we rinse it with the water, and finally we finish the treatment with skin repair or refresh mask. Here is again the full treatment protocol. So we can start to use redness cream just to soothe the skin 3 or 4 weeks before the treatments. Then we are doing 6 sessions of the peeling with 7 days interval. During the treatment, we can use redness cream always, and we can do 4 cycles of such kind of treatments during the year. Here you can see the result of full session of treatment after redness peel. And the product with which you can combine peel, or you can do it like in different sessions, but during the same period, like 1 week you are doing peel, the other week you are doing mesotherapy. It could be redness ID, which contains vascular complex, niacinamide, dexpanthenol, and Centella asiatica. So again, these are the products which possesses anti-inflammatory properties, soothing properties, protective properties, and also they will help to strengthen the walls of the blood vessels. So for redness is really, I like this product even for irritated skin. For rosacea, it works really, really very good. So I usually start with this product, let's say, not always with the peeling, but mostly with the mesotherapy, and then I evaluate, do I need really to do a peeling, or it would be enough to do like mesotherapy. So cleanse the skin using degreasing solution. After that, applying redness peel. We use soft or deep cleanser, depending on if it's oily skin or dry skin. Mostly skin with the cuperosis will be, or rosacea will be oily. Again, the peeling is in the ampule, so it's very easy to use it. You open it just before the treatment. Here we use a brush in order to apply it. It's very comfortable. So if the skin of the patient is hypersensitive, then yes, they can tell you that they feel a little bit of, I don't know, tingling sensations, not burning, but just some kind of irritation, but comfortable. You remember that the concentration of the active ingredients is not high, so it's not an irritating peeling at all. That is why don't be afraid of using it for any kind of type of rosacea. Remove the peeling. Again, you were not shown the soaking of the cotton pads, but I'm sure that Victor did it, because otherwise they would be sticky to the face. Redness injections. I like to do, so you can decide with what technique you can apply it. I like to combine several techniques, for example, point by point. at first in order to be more deep, and also point-by-point technique gives me the opportunity. For example, if the patient really have cupirosis, then if I will inject it right in the area of the cupirosis, in this damaged capillaries, there is of course high risk of bruises in this area. So every point of injection will be a bruise. That's why at first I'm doing point by point, and I can avoid these problematic areas as much as possible. And then more superficially, I'm using Dermapen, again with the depth of the injection like 0.2 maximum 0.3, and it gives me, so why do I like it? Because with Dermapen you're working with every square millimeter of the face and you will not get bruises. So in such a way I'm combining the therapy in different layers, in different techniques, and I think it is more effective. Here you could see Nappage technique, cream which we are going to recommend to use at home, redness. Of course, don't forget about sun protection. It concerns all the treatments we've been discussing today. So it's not possible to treat sensitive skin or skin with rosacea if you're not going to use creams with sun protection, with SPF factors. So it's extremely important. And in the portfolio of Innoaesthetics, there are two main products which we can use after the treatment, which we can recommend to use our patients as sun defense creams. And there is a great advantage that these creams are divided for normal and dry skin, which can be used for xerosis, for example, or sensitive skin, and oily skin, which you can use for acne problematic, for patients with rosacea. So I really highly recommend you. The protection factor is 50 there. So really they are very, very active and protect the skin in a proper way. If you have any other questions about the products, please, you can write them in chat. I hope that this information was helped you, was useful for you, that now you understand the peculiarities of products, how to combine them, how to explain why we use these specific products to doctors, to patients also. And I'm sure that you will love the result which you will get using this product and this specific treatments.
Also, just remember you that we're recording this webinar, so in a few days you will receive also the link with the recording. And also, if you want to have the presentation itself with the videos of application, we can send it to you. Especially because if you want to promote the products in your country, you will need to make the translation into your languages. If you have any questions in the future, you can always contact us. We'll be very happy to help you. If for now we have no more questions, thank you very much for connecting. Thank you, Anastasia, and I see you soon in the next webinar. Thank you very much. Have a nice day.
Thank you. Bye-bye.